Osteoporosis can lead to brittle bones and a higher risk of fractures. So what can you do? The answer's coming up. Hello healthy people, I'm Richard and welcome back to Exercise for Health, and in today's video I'm going to explain what exercise precautions you should take if you have osteoporosis or osteopenia. And I'm going to provide you with some great strength exercises that are safe and really effective for reducing the degradation of bone density. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Osteoporosis is a condition where your bones lose strength, making you more likely to break a bone than the average adult. Osteopenia is the name given to a level of bone density that is lower than average, but not low enough to be diagnosed as osteoporosis. From our late 30s, our bone density begins to decrease, although the rate of this degeneration varies from person to person. There are other risk factors for developing osteoporosis, however, such as very low body weight, smoking, drinking too much alcohol, as well as your genetics, taking certain medications for other health conditions like steroids, and women are at a higher risk than men, particularly following the menopause. It affects 3 million people in the UK and can generally be linked to fractures of the wrists, hips and spinal vertebrae following a fall, particularly in the elderly. The good news is that exercise can have a beneficial effect on the condition by promoting bone and muscle strength, helping keeping you steady by improving balance and coordination, and also helps care for your back. So I'm going to take you through 8 strength exercises that you can do at home, but if you want some additional exercises to help you with your balance, then click on the pop-out banner to go to a previous video I've done to help you stay steady on your feet and reduce your risk of falling. Before I start though, I want to offer my first piece of advice, which is to get out and walk more. The fact that walking is a weight-bearing movement and has a small element of impact will have such a positive effect on your bone strength. So try and do at least 10 minutes of walking every day. Right, let's go through the exercises. Right, safety first. Don't do anything that's going to compromise your balance and make sure that you work to your own level. For the purpose of this video, I'm going to show you the exercise and I'm also going to provide you with a progression if you feel that you can move on slightly. I aim to do these exercises at least twice a week on 2 different days, and you should also have at least 2 days rest between each one. And for each of the exercises, I want you to try and aim for about 10 repetitions. So that should be done slowly because the aim is we're trying to work on the strength component. But if you feel after a while that just doing 1 set of 10 reps is actually quite easy, then you can progress up to 2 sets. So the first exercise is going to be sit to stands, and as a progression we can move into squats. This is obviously a really good weight bearing exercise because as we're doing the sit to stand, the actual weight's going through the bones in the body, so that's what's going to help with improving bone and muscle density. So you need a chair for the sit to stand. I'm going to use the chair that's in my lounge, but actually a dining room would probably be better for this, so then you can hold onto a dining table as you're going up and down. So make sure you've got your feet a shoulder width wide. Make sure you keep good posture, so you're keeping your head and your chest up, and then with the chair behind you, you're just going to control yourself really slowly on the way down until you're in a seated position, and then from there, as soon as you got into a seated position, power yourself back up to a standing position again, and then you repeat again. Now really emphasize on the slow movement as you lower down, because that's going to really help work into the muscles all around the knees and the hips to provide more strength for you. So really slow on the way down, but you can come up just that little bit quicker. But you should be aiming for about 5 seconds for each repetition. So about 3 seconds on the way down and about 2 seconds on the way up. So to progress that, if you find doing 10 of those is actually quite easy, then you can do a squat, which is the same movement, but just without a chair. So I'll do this sideways on to show you. So again, I've got my feet to shoulder width wide. Posture remains exactly the same as before. Hand position can go wherever you prefer. And then from there, you just slowly squatting down as low as you comfortably can, and then coming back up to a standing position. Okay, so that will be a progression if you find the sit to stand too easy. So that's sit to stand, or progress into a squat, 10 reps for each one. Right, the second exercise we're going to do is step ups, and this is similar to the squat in terms of the movement, working around the knee and the hip joint with strength, but also that it's going to provide an element of impact as well. And a light bit of impact going through the bones is actually also going to help with improving bone density. So I'm going to show you the first way I want you to do it, and use, if you're worried about your balance, use obviously the banister to hold on to or something to hold on to wherever your step is in your home. And you're going to do a step up leading with one leg to slowly get to a standing position on the step, and then use the same leg to then come back down again, but just do it in a slow, controlled manner as you go up and down. And what I would suggest is that you do 5 leading with, say for example, like I'm doing the left leg at the moment to go up and back down. And then once you've done 5 slow that way, switch over and do 5 slow on the other side. Now as a point of progression, what you can do is do a single leg step up. So for this one, I'm just going to use my left foot to step up on the step, get to a standing position, the right foot's not actually going up, and then I lower myself back down. Just make the switch at the bottom. Now I lead with the right leg, so the right foot's up on the step, I go up and down and make the switch at the bottom. So you're alternating legs on this one until you've done 10 in total, so you've done 5 each leg. So the next exercise is basically going to be step ups, but for your arms. So we're going to be doing this a short distance away from a wall. You want your feet about shoulder width wide on the floor, and your hands will start a little bit higher up than the shoulders, but your hands being about a shoulder width wide on the wall. And it should feel like some of your weight is going into the wall, so that you can feel the weight going through the bone structure of the arms. The movement then is to make step ups with your hands. So I'm going to take one hand down, the other hand down, and then one hand back up, the other hand back up. So I'm making a step up movement with my arms, and you'll notice that as I go down, it creates more of a flexion of the wrist. So this is quite good to actually strengthen up those little small muscles around the wrist as well as we're going up and down. Now, if you find that one easy, then the progression with that would be to go from a vertical position to more of a horizontal position. So this is where if you're confident enough to get down and do the exercise on the floor, then you can do it in a more of a press up position on the floor. So the principles are exactly the same. So I'm going to do this on my knees, and I've got my hands initially directly underneath the actual shoulders, so I can feel the weight going through the arms from there. And then the movement is I step forwards and then step back with the hands. Okay, so again, it's providing a little bit of impact, but a lot of weight going through the arms this time in this horizontal position. Okay, so that would be a progression for your wall movement. Okay, the next one's going to be side stepping. So for this one, you can start with your feet just a short distance apart, but basically we're going to move one leg out to the side slowly to make the step and bring the other foot across, and then we step back again. Now I need to do this in a slow, controlled manner. So I'm using the outside of the hip muscles to move the leg out, but I'm also using the outside of the leg muscles to push myself away to move myself across. So it's done in a slow, steady movement until you've done 10 or 5 each way. If you find that one easy, then as a progression, you can start off a little bit lower down, so you have your feet closer together, because that'll make balance a little bit more difficult for you. Bend your knees and your hips, so you're kind of like in this quarter squat position. And then from there, stay low as you move yourself across the floor. And I'm going to go in one direction, so I might do 3, and then I'm going to then change it direction to go back. So I'm always staying low in this semi-squat position, and I'm doing it slowly, so that will just activate the muscles a little bit more around the hips. So that's a side step. Right, the next one is going to be wall press ups. I've done this in a few previous videos. So essentially we're going to be a short distance away from the wall. Hands are going to be flat on the wall, but a little bit lower than your shoulders. And then from there, feet back shoulder width wide, and just allow your elbows to bend as you let your body go in towards the wall, and then push yourself away until you're back out arm's length. So the elbows don't go up too wide, but again, it's another good one because the weight's actually traveling through the bone structure in the arms. So if you find that one easy, as a progression, we can then go to the floor like we did with the wall movement with the hands. So on here, again, I'm going to do it on my knees. So I've got my hands directly underneath my shoulders, knees are on the floor for a little bit of support, dropping the hips down, and then the same movement as we did against the wall. I'm just going to allow the elbows to bend, drop the body down, and then push myself back up to arm's length. Again, because we're working into strength, really important that you do the exercise in a slow, steady, controlled movement for about 10 repetitions. So that's the wall press up. Right, the next one we're going to do is a lunge. We're going to do this as a backward stepping lunge to start off with. So you want your feet shoulder width wide. For this one, again, in terms of balance, it's a little bit more tricky. So if you need to hold on to something next to you, then obviously do that for this one. But I'm going to take 1 foot back so it stays in alignment. So I've always got my feet about shoulder width wide. Back foot's on the ball of the foot. Once I step down in that position, I'm then going to bend the back knee down towards the floor, just as far as you comfortably can. Push it back up to the back leg straight, bring that foot forwards, and then do the same with the other leg. So step back, back foot on the ball of the foot, bending the back knee down, back up, and come forwards. So effectively, again, slow and steady, and you should be aiming to do 5 each leg or 10 in total of these. If you find that one's easy, then to progress it, we do it as a forward step and lunge, so this provides a little bit more impact. So again, feet are shoulder width wide, but this time I'm stepping forwards. That's where there's a little bit more impact, driving the back knee down, back up, and push back to a start position. So doing it as a forward step and lunge will just be that little bit harder and provide a bit more impact, but that's a lunge. Right, the last 2 exercises we're going to do are going to be on the floor. So I appreciate not everyone's going to be able to get down on the floor if you're watching this video. So you could actually do this laid down on your bed. So use the bed if you need to, but I'm going to show you on the floor for the purpose of this. So what we're going to do is do a bridge. So in a lying position, I'm going to have my feet shoulder width wide and my knees are going to be the same width. And I'm just going to rest my head down on the floor. So here you can use a cushion underneath you if you want to. Hands are just going to be flat on the floor to the side of my hips. And what I'm going to do is drive my feet down as hard as I can into the floor to lift my bottom up away so the hips are being drawn up towards the ceiling and then lower back down. And this is particularly good to work the muscles, particularly these gluteus muscles around the bottom that are really good at supporting the actual hip joint itself. So a really important one for this, to strengthen up the muscles around the hip. Again, slow and steady, and you should be aiming to do 10 repetitions. If you find that's easy, then as a progression, you can try this just doing 5 on each leg. We're just going to raise 1 foot off the floor slightly. So now I'm just going to use the other leg to do the bridge. So that's making it twice as hard, because now that one leg's got to lift my body weight up and then back down. Okay, so you do 5 on one leg and then 5 on the other leg. So that's the bridge. Right, the last one again is going to be on the floor, but this time I'm going to be lying on my front and I'm going to try and isolate the muscles in the lower part of the back around the lumbar part of the spine, so it's providing strength for that lower part of the back. So it's going to be a back extension. So the first way to do this is just to have your elbows and your hands rested on the floor, and you're looking straight down at the floor, and the movement from there is I'm going to use my lower back, not really pushing through my hands so much, that's just there for support, but I'm using the lower back to lift my chest up away from the floor, so I'm not actually pushing with my hands as such, and then lower back down. So I can feel the muscles either side of the back there. As I lift up, I can feel these muscles contract and then control it as you go back down. As a progression, if you find that's too easy with your hands here, then try it with your hands by the side of your hips. So same principle as you lift the chest up away from the floor. It'll just make it that little bit harder because you don't have the support of the hands anymore. So that will be a progression. So that's a back extension for the muscles in the lower part of the back. Right, one final piece of advice I have regarding care of your spine if you have osteoporosis is to ensure you don't load up your spine with a weight and perform a complex movement that can increase the risk of a fracture. So make sure with any weight training you do in a gym or resistance exercise you adopt, you should ensure your spine is in the correct alignment and you focus on working in one plane of movement. Technique and spinal stability are paramount. If you want more information on osteoporosis, then go to the Royal Osteoporosis Society website, as there is lots of advice on there too. I'll leave a link in the description below. I hope these tips help you with your management of a condition. If it did, please give it a like by clicking the thumbs up button below, and that'll help this channel grow so more people can benefit from these videos. Remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.